Please stand by for a provincial COVID-19 update.
Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for British Columbia for Tuesday, December the 29th. We're honored to be here on the territories of the Lekwungen-speaking people, the Songhees, and the Esquimalt First Nations. Tomorrow, Wednesday, there will be a written briefing with relevant information about the COVID-19 pandemic in BC, released at around 3 o'clock. On Thursday, there will be an in-person briefing with respect to the COVID-19 pandemic, which is Thursday, December 31st, which will be the last such briefing of the year. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you very much and good afternoon. As you know, for today we are reporting on 5 periods over the past almost a week. From December 24th to 25th, we had 512 new cases diagnosed with COVID-19. From the 25th to the 26th, an additional 447 people were diagnosed with COVID-19. Between December 26th and 27th, 424 new cases were diagnosed, and between the 27th and the 28th, 441 new cases. Finally, in the last 24 hours from Monday to today, we had 382 new cases diagnosed in British Columbia. The total for the last 5 days is 2,206 people who've been diagnosed with COVID-19, including 25 which were epidemiologically linked. That brings our total number of people diagnosed with COVID-19 to 50,815 people. Over the last 5 days, that includes 378 people in the Vancouver Coastal Health Region, 1,375 people in the Fraser Health Region, 44 people in Vancouver Island Health Region, 238 people in the Interior Health Region, and 171 people in the Northern Health Region. We now have 7,580 active cases around the province, 373 of whom are hospitalized, 80 people in critical care or ICU. In addition, we have 9,414 people under active public health monitoring, and that continues not to include the people who are under active monitoring in the Northern Health, as we're still working on the system. 41,175 people have recovered from COVID-19. As you know, we had a large number of people, sadly, who have been dealing with COVID-19 in long-term care. And over the last 5 days, we've had the tragedy of 74 additional British Columbians dying from COVID-19. Bringing the total number of people in our province who have died from COVID-19 this year to 882. Our condolences go out to all of the families who are mourning their loss, to the care providers, and to our communities who have lost loved ones. We know that this is the most challenging time to deal with these issues, not only because of COVID, but because of the time of year. We mourn with you and feel your loss intensely. We also continue to have new healthcare outbreaks, 8 of which have been called in the last weekend. Brookside Lodge, Rideau Retirement Residence, the Emerald at Elam Village, Heritage Square, Nordic House in Interior Health, and Chartwell Malaspina Care Residence in Island Health. As well, we have 2 more outbreaks in acute care at the Vancouver General Hospital and early onset of an outbreak at the University Hospital of Northern BC. In addition, the PICS Assisted Living, Courtyard Terrace, Agassiz Seniors Community, and Fort Langley Seniors Community have all been declared over. That leaves us with 56 active outbreaks in long-term care and assisted living and 8 in acute care. In terms of vaccine, to date, we have delivered 11,930 doses of vaccine to people across British Columbia in every health region now, including over the last 5 days. As well, this is all Pfizer vaccine, but as we know, the Moderna vaccine was licensed for use on December 23rd, and it has now become the second vaccine approved for use in Canada and will be arriving in British Columbia. Some has arrived today and some will be arriving tomorrow and in the next days. The timing is a little bit in flux, partly due to scheduling, but also, of course, weather across the country at this time of year. As soon as it arrives, however, it will be going to a number of remote and isolated First Nations communities that have been identified, and we've been working very diligently with our partners in First Nations Health Authority to make sure that all of the logistics and training and supplies are in place to make sure we can efficiently provide vaccine in those communities in the coming days. And I think this is a very important and exciting move forward for us here in British Columbia. As well, the Moderna vaccine will be used particularly in the north and interior and some parts of the island to be able to provide immunization to smaller long-term care homes that are in smaller communities. As well, we know that as late last week, we had the ability to start moving the Pfizer vaccine, and that vaccine is now being used to immunize residents of long-term care homes in some areas in the north and interior, but particularly in the Fraser Health and Vancouver Coastal Health regions. With the 11,000, almost 12,000 people who were immunized in the past week and a half, we have had 2 people who have had an allergic reaction to the vaccine. This is not unexpected given what we have learned about the messenger RNA vaccines and what we have seen in other jurisdictions. Both of these allergic reactions were treated appropriately in the clinics, and both people have fully recovered. Both were healthcare workers. So this is a very challenging time as we're ramping up and learning about these vaccines, how they can be transported safely, making sure that everybody is trained on how to administer them and monitor for events such as allergic reactions, which we know can happen with immunization. And certainly over the last couple of days, there's been a lot of learning and training going on so that we are prepared for how to move the Pfizer vaccine safely and in smaller doses into communities, but also how to receive and move the Moderna vaccine. And a lot of the work that we've been doing over the past few days has been to make sure we can do that as efficiently and safely as possible. Over the weekend as well, we issued a statement that we had identified here in British Columbia our first case of a person here infected with the COVID-19 UK variant known as B1.1.7. This person had returned to British Columbia from the UK and had been in quarantine, federal quarantine at their residence, as they were expected to do. A few days after they developed symptoms, and they were tested with our regular NAT test with the nasopharyngeal swab done appropriately, and it was confirmed to be positive for COVID. So that type of a test is the test that we do to diagnose COVID-19 across the province, and we've been using it, as you know, since it was developed in March. That test cannot tell us whether it is a variant or not. What we have been doing also from the beginning of this is using the expertise that we have at the BC Centre for Disease Control in particular to do what we call whole genome sequencing. That's where we look at the genetic sequence from the entire virus, the RNA sequence from the entire virus, to help us understand if there has been changes, if there are mutations, and it gives us a sense of where the virus may have come from. And the first time we were able to really use this to help understand some of the transmission of COVID-19 was when we had identified a person who had tested positive who had come from Iran. And so whole genome sequencing allowed us to determine that this was slightly different than the virus that we had seen before in people coming from China, for example. It also helped us understand the first wave of infections that we saw that were more closely related to strains that were seen in Washington State and also in Europe early on in March and April and May. So when this variant arose in the UK, and we understood when it was published on this gene bank website, so that we understood exactly where the variants were, the BC CDC went back to look at anybody who had tested positive on our regular test over the last few weeks, and then did the whole genome sequencing to see if any of them were actually carrying this variant. So far, this is the first case that has shown up. And out of caution, of course, we are making sure that this person remains in quarantine until their symptoms have resolved and they're no longer infectious. And we've done testing on anybody who is in that household, even though the person was meant to be isolating away from them. And this is to be sure that we're being extra careful about whether this virus can be transmitted or was transmitted to anybody here in BC. In addition, we have a number of other isolates, they're called. So the tests that were done over the past number of weeks in people who came from or through the UK, and those are going through whole genome sequencing as well. And it may well be that we will identify additional people who have this variant who are here in BC now. We know, though, that this variant does not seem to cause more severe illness, nor does it seem to have an effect on both the tests or the vaccines that we're using here in Canada. But it does seem, although the details are still unclear, but it does seem in the UK that it causes the virus to be more infectious. And there's one particular mutation on the spike protein that may make the virus more easily bind to the receptors, the ACE2 receptors in the back of our throat and nose, and thus make it more easily for someone to be infected with a smaller dose of the virus. So that is something why we're watching this very carefully and why we support right now trying to slow down any entry of that virus into the country with the current travel ban. As we've seen over the last few days, though, since it's been identified that it is likely that this variant of the virus is going to be found in many other countries, and I just saw this morning they found it in the United States and Colorado. So we are right now, the really important thing that we all need to do is to keep doing those things we know stop the transmission of this virus. This virus is even more infectious, potentially, with this variant. So it means we have to be even more adherent, making sure that we clean our hands, that we stay away from others if we're feeling unwell, that we stay in isolation if we have been around somebody who has COVID-19, that we wear masks and keep our physical distancing when we are out in public spaces, that we keep our numbers small. Right now, that's also an order that you need to stay with your household for any social gatherings. And that is important for us to prevent the transmission of all COVID, but now particularly this variant as well. It is also essential that anybody who has traveled internationally, in particular, that you must obey the federal quarantine and the full 14 days. And if you have any symptoms at all, to connect with public health to get tested. This is incredibly important, and it reinforces the quarantine measures that we have had in place from the beginning and how important they are for all of us. And avoiding all non-essential travel, particularly international travel right now, isn't a nice to do. It is a must do for all of us in this critical period of our pandemic. We know that the majority of people in BC are following our public health orders that we have in place. And like Minister Dix and I, this meant it was a quiet holiday, at least from a social perspective, with our immediate household, or if you live alone, with one or two of your close friends. Now I have another ask of you, to give the people in our health care system and in our essential services the reprieve they need. We need to make our entire holiday season a quiet holiday season, including the upcoming New Year's. The turning of the calendar to 2021 is something I know we are all looking forward to. How we mark this occasion varies. It varies across the province, it varies by countries, it varies by cultures. But what we have in common is to say goodbye to the old, say hello to the new, and to wish each other a year of happiness, of health, and prosperity. So absolutely, toast the year to come and continue your cultural, your family traditions. But we must do this without the usual house parties or celebrations this year. We need to focus on doing our part to ensure safe and good health for all of us. With that in mind, I want to remind people that our current events and gatherings orders means that any gathering in your home or elsewhere, any social gathering is not allowed at this time. That includes at restaurants and bars. There are to be no events in this coming weekend. We must only go to a restaurant with our own household. And I would encourage people to instead get takeaway from your local restaurant and celebrate with your household at home and connect with your friends and family remotely, as I have seen many great examples of people doing over this past weekend. This is what we need to do to get us through this hump in our pandemic and make sure that we enter 2021 positioned to immunize people who are most at risk and to get us through this next hard few weeks. Every person in our province now is a COVID-19 prevention expert. We know what we need to do to protect those around us, those we care for, and those we don't even know. Every time we follow the rules, we save lives. And right now, that is critical as we get through this important period. Every time you make the choice to bend the rules, to make them work for you, you put yourselves, your loved ones, and our communities at risk. By staying local, staying small, staying apart, by connecting virtually, it protects the people we care about most and ensures that the incoming months and weeks will be better, brighter, and safer for everyone. We need to finish this year and start 2021 in the best possible position, and that means stopping transmission of COVID-19 now as we roll out our immunization programs. And we also, of course, need to continue to be kind, to be calm, and to be safe. Thank you.
Thank you very much, Dr. Henry, and want to start by reflecting a 5-day report, of course, means larger numbers, both in terms of cases and everything else. But 74 people passed away in the last 5 days from COVID-19. And I want to express my condolences and my thoughts to the families, the friends, the caregivers, the communities of this 74 people, of the 25 who passed away from December 24th to 25th, 14 from 25th to 26th, 14 from the 26th to 27, 11 from the 27 to 28, and 10 from the 28th to the 29th. That's 36 people. In the Fraser Health Authority, 23 people. In the Vancouver Coastal Health Authority, 10 in the Interior Health Authority, and 5 in the Northern Health Authority. It is, as Dr. Henry has said, I think we all know, a very difficult period and a very difficult time to lose somebody. It's obviously, this period is a time of celebration ordinarily, even of coming together ordinarily. And so these are very difficult moments, and we want to ensure that everyone understands that we share their thoughts and share their grief and have them in our hearts today. In terms of, and I think it's just also a good reminder to have them in our hearts on New Year's Eve. and on other celebrations that are occurring in this coming period, period of the what is for some people a Christmas break. And I would just say this, that I think this year it's important to do, however one recognizes the passing from 2020 to 2021, and I know many people would see the passing of 2020 as being not soon enough. But when we do it, let's not leave our communities behind, our loved ones behind. Let's recognize that in our own spaces, with the people in our own households, and in our own households only. And whether it's watching the World Junior Hockey Championships, which are taking place, or other things, or Rick Mercer or Ryan Seacrest, or whoever we watch on this day, to do it in our own households and with no one else. And I think that's the way all of us need to respond to what we've seen in 2020, and to ensure that 2021 is in fact a better year. I just wanted to note with respect to acute care occupancy that we're running in our regular acute care beds at about 83.6% capacity, which is below what we typically do. That's our occupancy rate. And when you add the surge beds, the beds that have been added to address surges in COVID-19, our occupancy currently is 65.8%. In critical care, our current occupancy of regular critical care beds is 73.8%, and overall occupancy, counting the critical care surge beds, is 50.7%. In other words, in terms of our overall occupancy of beds, we are in good shape. Although the pressure in our acute care hospitals is significant, as you can tell by the level of hospitalizations, 373, and on other pressures on public health, including the 7,580 active cases of COVID-19, the 9,414 people under public health surveillance in 4 health authorities, and all of the work being done in public health. As Dr. Henry has said, in our first week of having the Pfizer vaccine, we received, as you'll remember, 4 flats of 975 doses, about 3,900 doses of vaccine, and essentially in the first week, from having the vaccine, all of that vaccine was in fact provided to people, which is good. Over this 2-week period, the one starting the week starting the 21st, the week starting the 28th, we're expecting 30 flats of 975, so that's about 29,250 roughly doses of the Pfizer vaccine. In the past week, 8,100 of those doses roughly were provided across health authorities, including a significant number this weekend. In addition, significant training to deal with the Moderna vaccine took place this weekend, and it's our expectation that the Pfizer vaccine that we will have received, in other words, we're not holding it back, will be delivered to people in the coming week. So that's our expectation of the system. So from 3,800 in the first week to more than 8,000 in the second week to approximately 20,000 in the third week, and that's building up and demonstrates, I think, the extraordinary commitment. That will be basically all of the Pfizer vaccine we have delivered in the period when it was expected to be delivered. I wanted just to bring you up to date on a couple of things we regularly bring people up to date on. We have another immunization campaign, of course, for influenza, and to date, as of December 24th, we know of at least 1,388,805 doses of influenza vaccine have been administered to British Columbians. We know that the number is actually more than that, because there's a 30-day reporting lag in terms of doses administered by pharmacists and physicians and other community practitioners, such as nurse practitioners. As of December 24, 2020, all indications of influenza activity remain exceptionally low for this time of year, despite continuing monitoring for influenza across Canada. In fact, the monitoring is more this year for reasons that everyone will understand. To date, there's no evidence of community circulation of influenza. However, influenza testing continues at elevated levels. No long-term care facility influenza outbreaks have been reported in 2020-21 Conversely, during the 2019-20 season, at this point, 6 long-term care facility outbreaks were reported in the same period. I'll also acknowledge the continuing extraordinary work of pharmacists, of course physicians and public health, but of pharmacists who have administered 300,000 more doses of influenza vaccine than during the same period last year, and we're very appreciative of their work. So I want to bring you an update that over the past week as well, the following PPE has arrived in BC, 60,880 N95 or equivalent respirators, 414,500 surgical or procedure masks, 41,672 pieces of eye protection, and 7,370,928 pairs of gloves. In closing, I just want to note that as we move towards 2021, I should say, we often think of resolutions, and I think we need to resolve many of the things we've been resolving to do over the last period, to stay apart and to follow public health guidelines, resolve to wearing a mask when we're in indoor public spaces, resolve to not going out and meeting people, resolve to not inviting people to our homes outside of our households, resolve to make the sacrifices we need to keep people safe and save lives. And carrying this resolve into 2021, we can make a real difference. And this week, as in past weeks, I'm asking people to dig in, to be 100% all in, to work as people in healthcare are, with dedication and determination to keep one another safe in this very, very challenging time. I thank everybody for what they did this weekend and what they did in recognizing, finding new ways to celebrate the holiday season. And I ask you to continue to do this in the coming days. Aujourd'hui, nous faisons le point sur le nombre de nouveaux cas pour 5 périodes de référence de 24 heures chacune. Je veux dire, premièrement, qu'il y a eu 74 nouveaux décès liés au COVID-19 durant ces périodes de référence, ces 5 jours. Nous offrons nos condoléances aux familles et aux amis des 882 personnes décédées de COVID-19 et à tous ceux qui ont perdu des êtres chers au cours de cette pandémie. Pour la première période de référence, nous avons eu 512 nouveaux cas. Pour la deuxième période de référence, jusqu'au 26 décembre, nous avons eu 447 nouveaux cas. Pour la troisième période de référence, jusqu'au 27 décembre, nous avons eu 424 nouveaux cas. Pour la quatrième période de référence, nous avons eu 441 nouveaux cas. Au cours des dernières 24 heures, 382 nouveaux cas se sont ajoutés. Il y a eu, et je veux dire finalement, que parmi l'ensemble des cas confirmés de COVID-19, 373 personnes sont actuellement hospitalisées, dont 80 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. As a reminder to everybody on the phone, please press *1 to enter the queue. You are limited to 1 question and 1 follow-up only. I would also ask that you please unmute your phones. You are not audible until your name is called. First question today is from Richard Zussman, Global News.
Dr. Henry, earlier this morning, Dr. Hillier in Ontario apologized for closing down and minimizing some vaccination clinics over the holidays. British Columbia also reduced hours at some vaccination clinics for COVID-19, and in some health authorities like Northern Health closed them entirely. Was it a mistake to do so, and are you concerned that we minimize the number of vaccinations that could have been done over the last week?
You know, I think we have done a lot of immunizations over the last week, and one of the things that we are learning is that this vaccine is fussy. Both of them. We're still practicing for receiving the Moderna vaccine, but it's not a simple thing to use the Pfizer vaccine, and so a lot of the time over this weekend was to build up the people, the training, and people to be able to safely do it and to take the Pfizer vaccine out of the point of arrival. And I know that every health authority was busy doing training, making sure we had the logistics in place, the complexity of pulling together the plans for the Moderna vaccine, particularly the vaccine that's going to a number of remote and isolated isolated communities. And my hat goes off to the people who worked all weekend to try and make sure we have that ready to go and people trained and ready to go. So it is not like there was not a lot of activity happening this weekend, and absolutely we're committed to getting as much vaccine as we can into as many people safely and efficiently this week.
Follow-up, Richard?
Another thing that was mentioned in Ontario today from General Hillier was around the Moderna vaccine and going down to 1 dose instead of 2 and having Health Canada look at this. Is that something that you believe could be helpful in terms of immunizing more people, especially residents of long-term care?
Absolutely. I think for both Pfizer and the Moderna vaccine, they are currently licensed as a 2-dose regimen. We have, from the very beginning, looked at the data that shows that both of these vaccines have very high vaccine effectiveness within 2 weeks of the first dose, upwards of 80% for both of these vaccines. And we don't know how long that immunity lasts. So we are absolutely asking Health Canada, the National Advisory Committee on Immunization, I know, and others around the world are looking at this too. So the people who, in the trials, who didn't get a second dose, how long did their immunity last? How good was it? There's lots of important things we need to look at. And we are looking at what we call vaccine efficacy here in BC as well. And our team with the Vaccine Evaluation Centre and BC CDC have already started that process so that we can monitor and make sure that if we're seeing breakthrough, for example, that we can record that. This is all part of understanding how new vaccines work. Right now, however, it is a 2-dose program, and we made the decision after careful deliberation and discussion of the ethical framework that we have around how we're going to deliver vaccine, and we made the decision that for December and January, all of our doses of both Pfizer and Moderna will be going to protect people with their first dose, because we can do that and protect over almost twice as many people as if we started giving the second dose in the short time frame that is in the product monograph. And the National Advisory Committee on Immunization does allow for an extended schedule. There's a minimum period that you cannot give a second dose because it's not effective, but it's anywhere between, the recommended period is 21 to 28 days, but there's no outside limit to that. And we have looked at when we're expecting to get vaccine and how much vaccine we're getting, and our, on average, second dose will start to be given in February, which means for some people it will be about 35 days, so an extra week. And we have good data to support that immunity is still very protective for that short window. So that's what we've been doing, and that's what we've been working, how we're managing it here in British Columbia. We're not keeping doses in freezers from the December and January doses at all. That was the recommendation of the company, but we have determined that now that we have some confidence in the supply that's coming in the coming weeks, and this was all very much up in the air, even as late as last Wednesday and Thursday. But that is the decision we've made here in BC, and we're comfortable with that moving forward for now. And I hope there will be some data that shows, I mean, it would be just wonderful if we could only, if people only needed a single dose. That would make our life so much easier.
Next question is from Denise Ryan, Vancouver Sun.
Hi, Dr. Bonnie Henry. Sorry, I was going to call you Dr. Bonnie. Congratulations on getting 12,000 vaccines in arms. That's fantastic. Yesterday, the BC Nurses Union criticized the rollout, stating they had knowledge of unnamed health administrators who had jumped the queue to receive the vaccine. Are you aware of any queue jumping? And if so, are you investigating this?
You know, I think this is unfortunate. We are rolling this out. The people who have been designated, our focus, as we said from the very beginning, is on protecting those who are most at risk, and that is our elder seniors in long-term care and workers in long-term care and key acute care workers, healthcare workers as well, particularly the ICU, COVID wards, emergency departments. And that is what the focus has been. Yes, there are some people who also have administrative roles who are in that group. For example, we have groups of public health and administrators who go in and manage outbreaks in long-term care homes, and they need to be protected so that when they go into those outbreak situations, they're not bringing the virus with them as well. So these are, we are confident that the vaccine is going to people who need it, and to healthcare workers and long-term care workers are our first priority. And I really encourage all of us to work together and make sure that we can support people to get this vaccine as quickly and as effectively as possible. And as we move into hopefully February, March, it's hopeful that we'll have both more of these vaccines, but also other vaccines that we can more broadly provide it to everybody, both in our healthcare system and in our communities.
Do you have a follow-up, Denise?
Yes, I do. Thank you, Dr. Henry. In terms of the vaccine rollout, between now and March, how many doses are we expecting in BC, and how many will be needed to cover those high priority recipients in care homes, residential care, and frontline workers?
Yeah, so we presented some of that data last week, and in most of it available publicly with the general list of the numbers in each of those categories. So I would refer you to that in the presentation from the 23rd. But in general, we have about 30 to 40,000 people who work in long-term care, and another 30,000 residents in long-term care, and we have about 20 to 30,000 healthcare workers who fit into that first priority group, and that is our focus for January, as well as remote and isolated and at-risk First Nations communities. And we're working very closely with our First Nations Health Authority and First Nations leadership in BC to make sure that we can identify those communities and people at risk as most efficiently as possible. Then we expand into a number of other priority groups between February and March, and those numbers are all there. But we do, what we've done is looked at how we can expand given what we expect to receive. And I will say that it's all based on expectations right now. The only guarantees we have so far are the vaccines that are arriving this week and next week. And we do not yet know for certain that we're going to get the quantities for the rest of January. But as we're getting into this cycle, and the cycle involves both the manufacturers, it involves the National Operations Center in Ottawa, and our teams here on the ground, as we're getting used to using these, as people are getting trained up, and as we get confirmation of more vaccine coming, we'll be revising and adapting as we go. I think it's also really important to note that we need to respond to what's happening on the ground in each area of the province. And for example, this weekend, the focus was on making sure we can try and protect people in long-term care that are having outbreaks, so that the outbreak doesn't expand rapidly and we can protect people as best as possible. So these types of decisions will be tweaked on a week-by-week basis, and depending on how we progress in the next few weeks. So this is again why it's so important that all of us do what we need to do right now to stop transmission, because it's transmission in our community that puts our elders, our seniors, and others in our community at risk. And now, as we're ramping up this immunization program and as more vaccine is coming, we need to hold our ground and keep the virus as low as possible.
Shannon Patterson, CTV.
Oh, hi, Dr. Henry. How wide will we be testing for this new UK variant? Will it only be tested for in recent international travelers or their close contacts who have tested positive, or will we or should we be testing for the variant in every single COVID positive sample in BC?
Yeah, so as I mentioned, there's two types of tests that we're talking about here. There's the test that diagnoses the virus COVID, and it looks at for specific parts of the virus genome. The whole genome sequencing is a more involved test. It looks at the entire length every base pair of the RNA of the genome. And it is much more involved. It's only done at one laboratory, and we've been doing surveillance of genomes, as we call them, since the very beginning, because we are one of the places in the country that has that technology and expertise. And my kudos go to our team at the BC CDC that have been working on this from the beginning. So it is not possible for us to do whole genome sequencing on every sample that we have, every positive test. So we do need to focus it. And since we've learned about this variant in the UK, we've been focusing it on anybody who has been in that in the UK in the last few weeks that has a positive test. So we're talking about several dozen. So it takes several days for these tests to be done. So it's not the routine diagnostic tests that everybody gets to be tested for COVID-19. And our proportion of whole genome sequencing that we've been doing is about the same as what they were doing in the UK when they enabled to detect this new variant. So we look for other mutations as well.
Follow-up, Shannon?
Since it spread so rapidly in the UK, I expect you think there will be more cases here. At what level would you be concerned about the variant spreading here, and could it impact restrictions in British Columbia if you're seeing a lot of it happen?
Yeah, so we've had these conversations a number of times over the weekend, even with my colleagues across the country, because that is, what is our aim right now? And this is why we were very concerned when we first heard the story from the cases in Ontario, that they had acquired this in the community, that they didn't have contact with the traveler, because that would have told us that this strain of the virus was already circulating. As it turns out, they did have. So this does tell us a little bit. So Ontario, Alberta, ourselves, the National Microlab have been looking at, we've all been doing this testing, this whole genome sequencing, to see if we can pick up cases in the community. And so far, we're just seeing a few of them here and there. And all of them so far have been linked to travel to the UK. So that tells us that it probably is not spreading widely right now. And it tells us the importance of, one, people not coming in from the UK, but also everybody who's coming in from another country, bringing potentially a different virus with them or another variant with them, needing to adhere to the federal quarantine for 14 days and to be tested if they develop symptoms. We cannot be allowing people to break quarantine, to not adhere to staying away from others when we know that this variant is out there and it's not yet circulating widely. So we want to keep it down and prevent transmission here in BC so that we can protect people with the vaccine and hopefully save lives.
Next question is from Mary Brooks, Island Social Trends.
Hi, thanks for taking my question. So I've been looking at the downward spiral, the burnout of healthcare workers that's been reported by BCNU and the reduced retention that they're talking about in nursing. And so I'm just wondering if the ministry has been tracking burnout in terms of sick leave numbers or people quitting and leaving their jobs, and whether the push for the surgical renewal might be cut back a little bit now, based on looking at how long this marathon of a pandemic is going to continue.
Yeah, well, I can tell you that I'm no stranger to feeling a little tired these days, and I know that many of my colleagues are too. And this is part of why we have the restrictions that we have in place in BC, because it is exhausting. Anybody who has been working as an essential worker in the last year now knows how challenging this can be, because it's not only dealing with the virus and all of the extra things we have to do in our healthcare system in particular, but it's also knowing that people are getting sick, knowing that that we have to use these extra precautions in our community as well. So it is very, very challenging.
And just to say, I think what we've seen in the last number of months shows the extraordinary work being done by healthcare workers, nurses, absolutely, health sciences professionals, healthcare workers, doctors, people who ensure that surgeries are safe and that the equipment is good, people who keep our operating rooms and our hospitals clean, and people who do that in all the other places in community and in long-term care. I think it's fair to say that we've had an extraordinary response from people who've retired to return to professions, which has helped us address our immunization campaigns, both for COVID-19 now, but for influenza, our other public health efforts, and all the other procedures we're putting on, and that it's an extremely challenging time. At the moment, we continue, and we are continuing our surgical renewal commitment. We think that commitment is important for people waiting for surgeries. I'll be reporting about that surgical renewal commitment and its progress in detail next week. We're obviously regularly in contact with the people working, and I can tell you across the board the level of ongoing stress related to COVID-19, not just in terms of workload, although yes, in terms of workload, but also in terms of what it means in facilities when COVID-19, when outbreaks occur, for example, is something we obviously monitor carefully. We know, and everybody should know out there, that we're asking a lot of people who work in healthcare, and we know, and everyone should know out there just how much they're contributing and sacrificing. And I mean members of the BCNU and of the Hospital Employees Union, of the Health Sciences Association, the Doctors of BC, QPBC, ambulance, paramedics, everyone around the province. And I'd say finally that we're doing this at a time of not one public health emergency, but two. The overdose public health emergency also has put extraordinary strain on many of those same workers, including many nurses, many doctors, many ambulance paramedics, many people who work in the community. And so this is a challenging time, and it should remind everybody of what we need to do today, tomorrow, the next day, New Year's Day, January 2nd, and the rest of January, which is to dig in, to follow public health orders, to ensure that if you have an obligation to quarantine, if you're coming back to our country, that quarantine is fully observed to its end, because the people who are dealing with those issues in the healthcare system are 100% all in, and we all need to be as well.
Mary, do you have a follow-up?
Yes, thanks. In terms of the UK variant and that being more contagious, and in your modeling exercises, Dr. Henry, you've given people these numbers to work with, like pulling back to 40 to 50% of normal interactions, for example, which sounded like the most recent level. Can you give people a number now of, in light of this new variant, how much more they should be pulling back? Should we be aiming for, say, 20%?
Yeah, so what we're talking about is infectious contacts. So the things that we are doing to prevent transmission are what is going to stop this virus. This variant is no different. So it's the very same things that we need to do that we did for the other variants that we've seen. So that means staying away from others, keeping our groups small, keeping our physical distance, wearing masks when we're in indoor public spaces. All of those things are the things that will stop this variant as well. And it just tells us that we have less room for error. It means that we cannot have more than our small group of household contacts, because even a smaller dose of the virus can lead to transmission and infection in others. So we know what we need to do. It's the same things that we have been doing. We just have a lower margin of error. So we all have to pay attention and, double down on doing what we know works right now.
Next question is from Rob Monroe, Info News.
Hi, Dr. Henry. I want to continue on that theme, and you talked about how it can adhere more in your throat, so if you get a little bit of it, you're more likely to get ill. But does it adhere also to other surfaces, like if you're out shopping, or do you have to be extra careful about hand washing because it may be adhering to parcels and packages?
Yeah, so we know that from the beginning that the particles on the packages are not the issue. It's if we get them on our hands and then we rub our face before we clean our hands. So it is exactly the same. We need to be fastidious about cleaning our hands before we touch our face, making sure we're not touching our face regularly. And it's not the spike protein and the receptor that we think, the mutation that we think causes it to bind more easily is to the receptors that are in our mucous membranes in our nose and throat and eyes and on our blood vessels and others. So it really is about our ability to be infected by the virus, not its lasting on the surface or anything like that. That part hasn't changed. And I will also say that, that we still don't know exactly what has led to the increased transmission that we're seeing in the UK. It's likely that it has something to do with increased infectiousness, but also about human behavior and the things that people weren't doing in terms of keeping distances, keeping small, especially in those areas where we know transmission is more likely. So that's enclosed spaces with large numbers of people, with crowds, when we're talking loudly without a mask on, when we're singing, when we're doing those things in confined spaces, it's much more likely to spread. So those are the reasons why we have the orders that we have in place now that mean we don't have events and gatherings right now. That is more important than ever. If you're going to a restaurant, go only with your household and maintain that distance. There's no table hopping. That puts the people who work in that environment at risk as well. Maintaining our distance when we go for groceries, when we go for essential things like medications at pharmacies, etc. Making sure that we keep those distances, avoid crowding, is more important than ever. We do know, but with this virus, like this variant, like the virus we've been dealing with for the last year, that it's safer when we have fewer faces and bigger spaces and outdoors. So go outside for a walk with your friend. Don't go inside. Don't have them over to your house. It's more important than ever to do the things that we know work.
Follow up, Rob?
Yes, the numbers of cases daily has come down significantly over the Christmas period, but we know that there is a delay. Are you expecting to see these numbers start cranking up, and when would you expect to see that happening if people were getting too friendly at Christmas?
Yeah, this is the worry, and we've talked about this before. There's a couple of reasons I believe the numbers are down. Partly it's people have not been going for testing as much, and we know that. We know across the province that people going for testing has been down by as much as 50%. And partly it's people don't want to be tested and have to isolate before this holiday, which is worrisome because we know that people are getting together, some people, and even if it's just your household, that you may bring this into your household and spread it to them. So yes, we expect testing to go up this week, and it is likely that we'll see more cases. We know the average incubation period, so after you've been exposed to when people start showing symptoms, is about 5 days, 5 to 7 days. So if people were around others at the Christmas period, we would start to see that in the coming days. And again, this is why we need to all take a step back. We have this new variant in our midst now. We know that it's coming around the world. We know that people are compelled to be with each other during celebrations, and we need to support each other to stay apart and connect with each other safely for this weekend in particular. That is going to be so important as we have vaccine and we're ramping up our protection of people in our community now.
We have time for one more question. For everyone listening, Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For updated province-wide restrictions, visit gov.bc.ca/COVID restrictions. And for information about the province's new orders and pandemic supports, visit gov.bc.ca/COVID-19. Last question is from Eva Eugen, CBC.
Hi, Dr. Henry. If we want to reach the target you've set of those 400,000 immunizations by March 31st, by my calculations, we need to be immunizing approximately 4,300 people a day and twice that number to give them 2 doses. Can you clarify how many doses of vaccine we've received so far and how many daily vaccinations we're able to complete at this point, and what you hope that we'll have the capacity to do on a daily basis?
So, yeah, as you know, we've received small amounts to start with, and the amount that we expect to receive by the end of December is about 30,000 doses. So we have not received all of that yet. We've administered about half of what we've received so far. We administered all of the first week and most of last week's doses as well. But we are ramping up. I think it's easy to underestimate how fussy this vaccine is, and having been at both clinics, two of the clinics so far, it takes time to train immunizers about how to handle it safely so that the vaccine is still stable and works, how to reconstitute it. It is a very short period of time that you can immunize. So these are all things that we're learning, and we're taking the time to learn from each clinic about how to do them more effectively and more efficiently. So yes, we are ramping up, and we expect to be able to have them, we're aiming for 100% of the 30,000 doses that we will have received by the end of this week to be in people's arms by next week. We know there's going to be challenges with geography and being able to get it to some more remote areas, but the aim is to focus on getting it as effectively and quickly as possible into long-term care. So yes, it's going to take a Herculean effort, and we're ramping that up and training people as we go. And a lot of this past weekend was learning from the clinics that happen, making sure people are trained on how to use Moderna vaccine, and getting ready for increased clinics this coming week.
Eva, do you have a follow-up?
Yes, thank you. With this new variant, can you say whether, if we see more cases of this, whether that will delay phase 4 of BC's restart plan, meaning that some of those events that people are hoping to start attending next summer will be delayed once again, and whether those will see restrictions extended or expanded because of this new variant? And can you get it in French as well?
Sure. Well, as you know, we have orders that are in place until January 8th, and every day we are looking at, do we need to do more? Are these still making sense? Where are the areas that we're seeing transmission? So those are things that we are monitoring on an ongoing basis, and we will have more, of course, to say next week as we approach January 8th. It does make us more concerned when we have seen some of this variant here in BC, whether it is transmitted, whether it starts being transmitted widely, whether there's more cases out there, are things we are investigating. And absolutely, if we start to seeing spread more rapidly and more increased numbers of cases going up logarithmically, as we saw in October, and if we're seeing in other places around the world, then that would be very concerning, and we would need to take additional measures. As we're ramping up vaccine, of course, we're looking at how we can get to that level in our community where we stop transmissions because people are immune. And we are hopeful that that is going to be sometime next summer or into the fall at the latest. And that's what our aim is. So the restart plan, which was designed for last summer when we didn't have vaccine in the mix, will need to be rethought. But right now, we're really focusing on how do we get through this period now of our pandemic now. And right now in BC, we've leveled off and we've come down a little bit, but it is critical we keep doing what we're doing. And this variant reminds us that we cannot be complacent. And it's going to be so important last week, this week, next week, to take those measures to stop transmission, each and every one of us, every day.
Oui, juste pour dire que, bien entendu, on va étudier tout ce qu'il faut et prendre des décisions qu'il faut dans l'avenir, ce qui est essentiel actuellement. Depuis 5 jours, on a 2200 à peu près, un peu plus, nouveaux cas de COVID-19. et nous avons 74 personnes qui sont décédées de COVID-19 pendant cette période. Donc, ce qui est essentiel actuellement, c'est de suivre les ordres de la santé publique, les ordres de Dr. Henry, et de continuer de le faire. Bien entendu, s'il y a des nouveaux éléments, que ce soit cet élément d'une variété qui viennent, semble-t-il, de la Grande-Bretagne, c'est seulement un cas, mais il y aura beaucoup d'obstacles entre où nous sommes actuellement et où nous voulons aller à l'avenir en 2021. Donc, ce qui est important maintenant, c'est de suivre les ordres. Ce qui est important, c'est de suivre les conseils de la santé publique. C'est essentiel parce que la situation est sérieuse actuellement, aussi sérieuse que ça peut l'être, en fait. C'est une journée très difficile et je pense que la leçon d'aujourd'hui, c'est de suivre ce qu'on dit actuellement et de continuer de faire ce qu'on fait, essayer de faire ensemble, c'est-à-dire de protéger ce qui nous aime et de protéger ce qui nous ne connaissons pas. Merci beaucoup. À jeudi.
Thank you.